Let's now bring Tebogo in. Tebogo, very good evening to you. We know that the General De La Rey Hospital has 4 wards. When it comes to its significance and the communities it serves, how much of an impact will it being closed have on the community?
Good evening, Mpo, and of course to the viewers. You know, this hospital is the only hospital in the Ditsobotla area, you know, servicing the people of the Ditsobotla municipal area. You'd remember that in 2022, there was a hospital called Tusong Hospital. It was also in Ditsobotla. It was not operating for many years. And in 2022, the Department of Health decommissioned the hospital, saying it is built on a dolomite soil. Now, this meant the General De La Rey remained the only hospital that the residents of the Ditsobotla will then use. This really affecting them. This the temporary closure that we see now due to floods will really affect them, because they now have to travel even further to Zwaing. Others come to Mahikeng, while others will have to go to Ziras, that is 80 kilometers, away from where they are, to access health services as far as the hospitals are concerned, Mpo.
I suppose assessing the infrastructural costs and damage is a huge chunk of what the minister, had to inspect today. What was he looking out for?
Most definitely. He actually, did a walkabout and went outside the hospital yard, where we saw him going to one, stormwater system. We are told by the department that this stormwater system is actually supposed to be manned by the Ditsobotla local municipality, which is now accused of not doing its job. So he did go out to look at this, pipes and the stormwater systems. Quite a challenge, given that they did state that Sunday evening they saw water coming into the hospital. That's when the hospital was flooded, because these stormwater systems were not channeling water to the correct direction. But not only that, when we went inside the hospital, we were also able to observe that as far as maintenance is concerned, it's quite a challenge. The hospital seemingly not maintaining its infrastructure for quite some time. You would see ceilings that are almost about to fall, and with this hospital having 4 wards, at the core of this ward being the maternity ward, you can imagine many of the women who would have to give birth far away from their Ditsobotla area. In actual fact, we were told that on Monday, when patients were being moved to other facilities, 3 of the women were in labor.
Sure. And when it comes to the costs of the repairs and for this hospital and the others which have been affected, is there an indication and a sense of what this budget will entail?
Not at this point. The 3 hospitals, they include Lihuruti Hospital. We are told that all has been fixed at that specific hospital. The second one was the Moses Kotane Hospital. We were told that in actual fact, the disruptions were only for 2 hours. Therefore, all is back to normal. In actual fact, the patients were not affected in any way, as they were still able to receive healthcare services. It is the General De La Rey, which is the most affected. The MEC, as well as the Minister of Health, MEC Selolehare and Minister Aaron Motsoaledi, did indicate that they will then appoint a contractor who is expected to start with repairs this week. As far as the budget is concerned, we have not been told how much will be spent to, as far as maintenance is concerned. But we spoke also to the local business forum, which was concerned to say, we've seen projects in the past, budget allocated to specific projects, yet many years later, we are still waiting for those projects to be complete. Therefore, they were calling for the MEC and the minister to monitor the funds that will be used to repair this hospital, to ensure that in few days, at least, if not weeks, residents are able to receive healthcare services from this General De La Rey Hospital.
With 35 patients being moved from this hospital, I mean, what have they had to say? How have their loved ones reacted to this move? And do we even know if anyone was injured during the storm?
We know that no one was injured. They were all safely moved to Mahikeng Provincial Hospital, others to Lihorutse Hospital, while the others were sent to Gelexpan. All these three hospitals are more than 60 kilometers away from the General De La Rey Hospital. We spoke to an outpatient who on Monday was not able to get the help that she needed, and it really was a disappointment to some of the patients who really are in need of this specific hospital. Many of them saying they do not have the funds to travel further to other hospitals, but of course the Department of Health stated that they will also use some of the town clinics nearer to Lichtenburg. But you can imagine, for someone who would spend 20 rands or even walk to the hospital, they now have to spend more to go to Mahikeng Provincial Hospital, which already at this point also has its own challenges, given that many of the residents across the Ngaka Modiri Molema District municipality and others outside the district are already using the same facilities of the Mahikeng Provincial Hospital. Those in Lihorutse, the same. The Ziras area, the Lihorutse area, they are using that hospital. This means, we will then see long queues as far as these other hospitals or healthcare facilities are concerned, due to this specific hospital no longer working thus far.
Yeah,
temporarily,
absolutely.
that is.
Absolutely. Thank you so much for your time. Of course, a story that Tebogo Phakedi, SABC News Reporter, will continue to follow and track for us here on SABC News.